All right, we're live.
Okay. Hi, welcome to today's Women's History Month medical panel. I'm Brittany Horn, Director of the Joint Use Library on the Virginia Beach campus of Tidewater Community College. With me is Amanda Leo, Director of the Occupational Therapy Assistant Program. Thank you for joining us as we speak with 5 women in the field of medicine. They'll share with us their successes and challenges as professional women doing really important work. We hope you'll come away inspired and better informed about working in healthcare. For those of you interested in pursuing a career in healthcare, TCC offers 13 programs in the health professions pathway that can get you started in a rewarding and in-demand field. We'll hear more about the opportunities TCC has to offer later on in the session. If you have questions for the panelists, please post them to the YouTube chat and we'll get to as many of them as possible after our prepared statements. Our panelists represent a variety of specialties and can speak to the diverse experiences of healthcare professionals, including their unique and shared challenges. Now I'm going to ask that they each give us a brief introduction and talk about their backgrounds and positions they currently hold. So we're going to start with Dr. Rashida Gray.
Well, good afternoon, and thank you for giving me this opportunity to speak to the students. So I'm Dr. Rashida Gray. I am a psychiatrist, which means that I am a physician. I've gone to medical school. I always wanted to be a doctor. I was 5 years old with the play school doctor kit, and I really never considered any other field other than being a fashion designer, which was really not an option because I cannot draw. And I am from the Philadelphia area, and I now live in Richmond, Virginia. I have worked in hospital settings, outpatient settings, academic institutions. I've worked in acute care. And in 2019, I decided to venture out on my own and take the entrepreneurial path and open my own practice. And so I am the solo owner of my private practice, Gray MD Psychiatry in Richmond, where I see adult patients. Which has given me some autonomy and independence, and also the anxieties and joys of being an entrepreneur. I'm also involved with some charitable projects that are very close to my heart, and I am a mother of 2 college-age kids, and I am a wife.
Thank you. Dr. Tamika Lashege.
Hello, hi, my name is Dr. Tamika Lashege. Before entering middle school, actually, I decided to become a pediatrician. And to accomplish that, I received a bachelor's degree in biology. Then I went on to attend medical school. During my residency in pediatrics, I fell in love with neonatology, which is caring for ill newborns and premature babies in the neonatal ICU. So I furthered my training and became a neonatologist. I practiced clinically until about 2013. At which time I entered what I call the payer realm by joining a managed care organization as a medical director supporting quality improvement and value-based care for people who utilize Medicaid for their health coverage, as well as for providers who deliver and coordinate that care. I now have a master's in healthcare administration, and I am currently a chief medical officer for United Healthcare. Thanks for having me.
Thanks for being here. Dr. Martha Maynor.
Hi, hello everyone. Thank you so much for including me today. Around the time of high school, I had a family member who had severe psychiatric illness that did result in a fatality. And I actually, initially my ambition was to go to medical school and do psychiatry. But once I got to medical school, I actually really enjoyed my time with both mothers and babies and children in general, and then decided to do pediatrics, then train also in neonatology as well. I really love doing procedures and being involved in more critically ill patients, which kind of led me down that path and away from my original intention. At this moment, I am in private practice. Our private practice group is owned by a group called Pediatrics that actually owns a lot of physician practices throughout the country in neonatology. I work at a really busy ICU here in Atlanta, Georgia, and sometimes we do some research, and sometimes we do some mentoring of people that are learning how to be nurse practitioners or residents coming through, or fellows coming through for a single rotation, but we're primarily a private practice. And thanks again for including me today.
Thank you. Dr. Tori Tucker.
Hi, everyone. I'm really happy to be here. I am from the Richmond, Virginia area. I started out not thinking I would be in healthcare at all. My plan was to be in foreign affairs. I was attending college as President Obama was newly being elected for his first term, and so saw international relations and foreign affairs as my priority at the time. But I had a foreign affairs course that was near the School of Nursing. It was actually in a nursing building. And while in that space, I just fell in love with the fact that the nursing students were learning in real time things that they were applying in their clinical setting within that same week. I also saw the dynamic relationship between the faculty and the students and the ability to have this exchange of learning outside of the classroom that I had not uniquely seen prior to that. I applied to transfer into the School of Nursing. I'll tell you about that story at another time, but let's say I took several routes to getting into the School of Nursing, and once in, really just fell in love with the opportunities to impact nursing, to impact patient care and the community simultaneously through a profession that had many open doors. I currently work as a palliative care nurse. I originally started out as a cardiac nurse and worked at a community-based hospital. And then in 2014, transferred to a level 1 trauma center where I've been working as a palliative care nurse since that time. I am also a historian. I have my PhD in nursing and have the ability to see systems in a way that I had not done while working at the bedside. And so I like to say I'm a nurse by night because I'm working night shift currently, and a historian by day.
Thank you. And last but not least, Dr. Paula Young.
Hello, good afternoon. Thanks for having me. I tell you, I know the ladies on this Zoom here today, but man, you guys are dynamic and hearing it all at one time. I'm sitting here like, wow, these are my friends. So I am currently the medical director of community health access for Bon Secours Mercy Health Richmond Market. I'm also the medical director of Richmond Community Hospital and pediatrician for their caravan. So I knew I wanted to be a pediatrician because I liked my pediatrician when I was a kid. And I was like, I want to be just like Dr. Painter. He didn't give me my vaccine, so the nurse gave me the vaccine. So me and Dr. Painter were really cool. And I, went to medical school. I started out at Tulane and got a bachelor's degree in biomedical engineering. At the time, I'm a plan A, plan B kind of person. Like, you should believe in yourself and believe you're going to achieve your dreams. But I was like, I like engineering. I like medicine, biomedical engineering. That sounds great. However, I did fortunately get accepted to medical school at the University of Virginia. And then I went and did a neonatal, a pediatric residency at LSU in New Orleans, then a neonatal perinatal fellowship where I met Dr. Maynor at Emory. And then came to work at Bon Secours in Richmond, Virginia. Since I've been here, starting out in the NICU, and that's an ICU for very sick newborn babies. I started having some beginning of life questions and doing some ethics consults. I then joined the ethics team. I then start taking classes online at Creighton University and then end up with a master's in healthcare ethics that put me with the outreach team. So that's how I got involved with the Caravan, which is our mobile free clinic for the uninsured and the underinsured. And under that realm is their medical director. I also oversee EWL, which is our Every Woman's Life, and they handle female needs for the uninsured and underinsured. The violence prevention team, which encompasses our forensic nursing to help for women when there are times of violence in their life and they need assistance and care. And then the Caravan, which is where we see all patients that are uninsured. So that's sort of how I got to this point. And there's been several pivots in my career. But as you can see, some of us have similar pediatric backgrounds and it can lead to many different places in your career as you grow and develop.
Wow. Thank you all very much collectively for sharing your backgrounds and your journeys to where you are today. I'm going to introduce the next question for each of you to consider, and it is, our community college students overcome barriers in their pursuit of education? Can you tell us any barriers you may have had to overcome in your career path? And we'll start with Dr. Gray.
Okay, so such a great question. I initially struggled to sort of come up with answers to this question, and had to sort of pick my husband's brain to get some help with this one. And the reason it was tough was because the barriers didn't look like barriers to me. There are no physicians in my family. I am the only one. Neither of my grandparents went to college. My mother finished college. My father did not. I have a family history that probably looks like a lot of people's family histories who are currently watching this and maybe on this panel. There's mental illness, there's substance abuse. There are not a lot of physicians on my family tree, just me. And I always saw that as a motivating factor. I came from a neighborhood where my friends that I grew up with didn't go off to college. And so again, I saw that there was something bigger for myself. I always enjoyed science and knew that I wanted that career. I knew I wanted something more than my parents were able to provide in terms of a financial situation. And I wanted to be able to go into a career that could make a difference. And I just tried to look at those barriers as being motivating factors. As a physician, or I guess in medical school, I actually had 2 children in medical school, which everyone will tell you is not a good idea. But life happens, and as women, it's not forever that we can have children. And so I chose to have my son and daughter in medical school, which did extend my medical training by a year. So I graduated a year after my classmates. But what bigger motivator than having children and a family to take care of, to push you to stay up late and push you to study a little bit longer so that you can finish and achieve your goals. So yes, I have had barriers, but I have always used those as motivating factors on my career path.
Thank you very much. I really appreciate your statement. I actually wrote it down to share with our students that barriers didn't look like barriers to you. And some of the things that we overcome in our own lives may not be barriers to us, but sharing those with other people can help inspire them. So thank you very much. And next is Dr. Lashige.
Hi, Dr. Gray, that was inspirational even to me. And I want to thank you for sharing your story because it's personal, but so many of us need to hear it. I had a totally different thought about coming up with barriers. I thought, oh my gosh, there's so many to choose from. So I would say that careers in the healthcare field are, I think, rarely a straight path. And they tend to have major assessments or examinations that serve as qualifying doors that allow you to enter the next stage. And so test taking has repeatedly been a struggle for me. From elementary school through high school, things came very easy to me. Academics came very easy to me. And I realized that I never learned how to study because I didn't need to. Well, that reality hit me when I thought the stakes were high. I was learning how to study for the first time while taking on a heavy course load at Yale University. I didn't have anyone in my family that had gone to college that can lend me advice or tell me about an experience where they experienced something like that. And so I was out on my own, right? I felt like I wasn't afforded the time, space, and guidance to develop those skills at that point in my journey. And this struggle rolled all through medical school and afterwards. I learned more and more each time, but it always seemed to come after falling short on crucial exams. In fact, I met one of my best friends who's on this very panel because we leaned on each other as study partners, and we still do so today. So that's the barrier that I want to share.
Thank you so much. I am certain that a lot of our students and listeners here today can very much relate to that story. And it's something I hear frequently as well here within the health professions, where students, things may come naturally to them until all of a sudden they're not. And where are they in that journey when that occurs? So thank you for sharing that. Dr. Maynard.
Yeah, I honestly I had a lot of trouble thinking of like legitimate, real barriers. I mean, I am the only physician in my family, but my family generally, it was an expectation that we would be at least going to college. So I definitely didn't have to overcome that. I did get a little bit of being a woman from the Deep South. Well, you know, why do you want to be a doctor? A little bit, but it was such a small barrier because I really did want to be a doctor, and I was determined, and you know, that didn't really change my mind. I do feel like maybe a little bit because of that, social things fell by the wayside. I think I may be the only unmarried person on the panel. It's not all bad, but yeah, I really can't identify any you know, severe barriers. I know other people face a lot just getting to their education, and I you know, other than some debt after college and medical school, you know, I really feel like I have no real right to complain.
Well, thank you for sharing. We do appreciate it. Dr. Tucker.
Yeah, I appreciate everything that my colleagues have shared, and I'm grabbing nuggets from them as well. In terms of barriers, I would say they were at two different points of my career path. So I attended the University of Virginia for my undergraduate education. And as I shared earlier, I was not in the School of Nursing. I was actually in the College of Arts and Science, and applied to transfer into the School of Nursing directly after my first year. And I did not get in. As I say this, I'm like, that means it's like, okay, you didn't get in. But as someone in, you know, end of my teen years, entering my 20s, that rejection felt like, well, this door can't open for you. And I remember having a conversation with my mom, and I just said, well, I guess nursing's not in the path for me. And she just said to me over the phone, since when did we stop at the first no? And it was almost like a girding up of knowing your family history and knowing that resistance has happened historically in the past, and you will face it again in the future. But that doesn't mean there isn't a way over or around, or that one person's no is the indefinite answer for your purpose and your path. And I said, okay. And so I ended up using that no actually as a year to take prerequisites, as many as I could outside of the School of Nursing. And I found a mentor. I got to shadow a nursing colleague in the ICU. And I leveraged relationships, and I leveraged volunteer opportunities. I ended up volunteering in hospice. And what I probably couldn't foresee is those early seeds of working in hospice and doing home visits prepared me to be a palliative care nurse almost 8 years later. I just didn't know that at the time. And so I reapplied to enter the School of Nursing, and I'm a completely different student. My ability to assess what a nurse can do and who a nurse can be looked very different. But I, as a personal person, brought a new experience and perspective to my application. So I got in. And so I would just say the first barrier is what do you do when you face rejection? Will you move around it? Are there other paths? And then I would say the second barrier came in my PhD program. So I started my PhD program in 2015. I was fortunate at the time, there was a BSN to PhD program. So I did not have my master's at the time. It just looked like extended coursework. What I wasn't expecting is that my mom and I would become a caregiver for a loved one with dementia. And so majority of my PhD experience also looked like being a caregiver. And I watched my mom care for a family friend and wanted to step in and help. But that did mean, I would just say, putting school aside for a little while. It was a priority, but it wasn't the only priority. And I imagine for many of us on the panel and many of you listening, you probably can share whether you're caregiving because you're a parent, caregiving for a partner or a loved one, or you may navigate your own role shift while you're pursuing your career or path, that adds a level of responsibility and pivoting. And so I saw that as a barrier, but also it's ignited my passion to advocate, use my PhD and my nursing degree to advocate for caregivers. And what does that look like from a policy standpoint? But what does it also look like investing in our caregivers and changing that infrastructure? And so it was a barrier, but it's something that has now motivated me also professionally in the work that I do today. And I meant to add Dr. Maynor, I'm not married either. So on the path, you do make different sacrifices,
Yeah.
but it takes a village to do this. And I'd say every barrier has required me to have family, friends, or colleagues that have been present.
Thank you so much for sharing that, because I think it must resonate with a large group here in the community college level, not just with the sacrifices that we face every day, or we have to make decisions sometime, is to reprioritize or restructure those priorities at the time. And that it's not always a straight path. It's not always completed in that timeline of what we expect. And I really appreciated you having that question of what do you do when faced with rejection? It's like, boy, we should put that in our application interview, because I think people understand that healthcare is competitive, but maybe not realizing how competitive so many health professions programs can be. And maybe you don't get in that first time, but how can you seize that opportunity to seize it as an opportunity to, further your knowledge, further demonstrate your commitment and grow during that experience, and still come back the next year, as you said, even better than the year before. So thank you for sharing that. And Dr. Young, would you please like to share?
Yes. So I'm listening to everyone. And so I actually had a couple of barriers I could have talked about. But each of you have touched on a few of them. So we've dealt with the no, we've dealt with the test. Yes, I'm the only MD in my immediate family. And I am a newlywed, technically. I got married much later in life. So it can happen. So the barrier I'm gonna stick to talk about is being diagnosed with a chronic illness. So in 2008, I was diagnosed with multiple sclerosis. That's a neurologic disease that affects your nervous system. There is no cure for it, and it is progressive. And I have had some progression through the years. I still get around well. I even sometimes use a cool scooter. But with that said, that's when I had a pivot in my career. I was in the NICU, I was in the ICU, in the hospital, running around, emergency deliveries, and going to get the degree in ethics is what opened that door for the pivot. The Caravan, which is the mobile free clinic, their pediatrician was moving on to another opportunity. And so when that became aware to me, I inquired about it and decided that I would move forward with trying to do that. Being in the NICU, I found it a very fulfilling career, because taking care of young babies and their families is so much in those times of need. What I found at the Caravan is being there for vulnerable patients during their time of need has been tremendously rewarding to me, and patients are so grateful when it's something that seems as simple as getting your vaccine. But when I can give you your vaccines or my healthcare system can get you your vaccines at no cost, that is priceless to a family who needs to get their child enrolled in school. So making that pivot and still being able to be mobile and positive and be surrounded with such a good circle of family and friends and people who share love with me every day, has just really meant a lot to me to get over or through this barrier. I always share a quote that my sister, Dr. Campbell, shared with me at the time, because I was working in the NICU and I was like, I'm struggling. I'm gonna have to leave the NICU and she says, and do general pediatrics. And she says, if that's your biggest barrier in life, cry me a river. So, I just had to, and when I look back on it now, she was so right. At the time, sometimes barriers seem so massive, but in the big scheme of life, they are life-changing moments. They are ways to see life through a different lens. You are being prepared for another part in your journey, and you can't even see it at the time when you're going through it. But once you get to the other side, you look back and you just see the blessing in all of what you have achieved and all of that you have gone through and what you have learned from it.
Thank you very much for sharing. I often heard individuals say that one person's struggle leads to be another person's motivation. So I appreciate everyone here sharing your struggles and your barriers, and also that critical, I think, shift in focus that several of you shared throughout that time when you had a barrier. How did you change your focus to what was important to you at that time and what you needed to overcome? So I'm going to go ahead and introduce the next question. And that is, Tidewater Community College students achieve associate degrees and certifications. What advice would you give our students about getting into healthcare related fields?
Okay, well, I'll start. So I would start by saying that working in healthcare is a privilege and an honor. And I try to remind myself of that every day because it's also very stressful and challenging at times, but has afforded me opportunities and life experiences that I cannot have imagined getting anywhere else. Working with humanity on a daily basis is a part of that privilege. I oftentimes tell people that, although I am in my 40s, through my life, through my work and working with patients, I feel like I'm like 150 years old. And I don't mean because I feel tired and drained, but just, meeting so many people and learning about people's life experiences and walking with them through their health journeys just affords you the opportunity to understand people and life on a level that I find some of my peers that don't work in healthcare don't necessarily have that window. I think it affords you the opportunity to have a level of compassion and sensitivity to people that is necessary, but also comes out of the work that you do with patients. I would also say that working in healthcare is, wherever you come in, whatever your entry point is generally your starting point. And I think you've heard that in some of the other panelists' stories. Whether you come in as a nurse or you come in as a tech, generally that's our starting point. Healthcare really allows one to move laterally, horizontally, vertically in many different directions as you evolve and grow, as healthcare evolves and grows. I have witnessed people working in the Starbucks at the same hospital, a nurse several years later. I have witnessed people working in the cafeteria, and moving up into, other areas of healthcare. And so I would just say, if you love healthcare, you're not quite sure what you want to do, start somewhere, get your foot in the door, learn, ask questions, be very observant. I learned about fields in healthcare long after I became a doctor working in hospitals. There are so many options in healthcare that no one teaches us. It's not just being a doctor and a nurse. There are so many other areas that you may want to look into and consider that can afford you many different opportunities and life experiences. So
Thank you very much. Dr. Lashige.
Sure. My advice would be to collect mentors, similar to the experience Dr. Tucker shared. Instead of souvenirs, I admit that I collect mentors to guide me and challenge me and support me. They are all different demographically and professionally, but what they all have in common is that they've committed to developing a supportive relationship with me, and they want me to succeed at whatever I choose to do. Be very intentional, not necessarily calculated. Make it personal by choosing people that you can be very honest and vulnerable with. Then you will gain the most from the relationships.
Thank you very much. I'm taking so many notes to share here. Collect mentors. Thank you very much. Dr. Maynard.
Yeah, I mean, in the NICU, it can be a very stressful environment. There are babies that do not survive. We rely on a very extensive team of nurses, respiratory therapists, X-ray techs, even environmental services. We have physical therapists. We have and they are very, especially towards the end of a baby who is improving hospital stay, they're very helpful in helping those babies learn to orally feed for the first time when they were stuck on a ventilator from being extremely premature. So, the whole team, just showing compassion to everyone, both in the team and the families who are, they are suffering some psychic pain because their baby is not they are not going the path that they had hoped when they first became pregnant with that baby. So but there are many I may be doing a little bit of repeat of Dr. Gray's take, but I definitely feel like there are a lot of different aspects of care in at least the line of work that I do in hospital, and the same is true of people that work in offices. They have medical staff, people that greet people at the door and take down basic histories, medical techs. So we all rely on being part of a very extensive team to get the work done.
Thank you very much. I appreciate you mentioning the team members that go into the care. And I think later we'll also talk about some of the programs that TCC has to offer. But many individuals, as you've all mentioned already, think of healthcare just from the doctor perspective, or as their benchmark of where they want to be. But you're right, there are so many healthcare workers along the line and involved in that critical care for successful outcomes. So thank you for sharing that. Dr. Tucker.
I was going to build off of what Dr. Lashige also shared about mentors. And I was thinking about advice that I wish that I had especially adapted early on in my career, is both investing in the mentorship relationships, but also knowing that mentors sometimes will look like colleagues, and mentors may also be outside of your field as well. And there's so much that you can gain and learn. And I recall, especially once you're in the programs, of course, it feels very finite. And so the GPA feels like it's the most important thing. Passing the test, of course, feels like the most important thing. And all of these aspects are important. But I'm also here today to tell you that no one has ever asked me what was my GPA. And so when I was an undergraduate, a colleague of mine who's now a nurse practitioner, we used to always say, we may not have 4.0 GPAs, but we have a 4.0 in life. And today, as a palliative care and end of life care nurse, that's something that I follow and I take with me. And I share that because I think in the process of pursuing perfection and being number one and at the top, you can miss the community and the journey. And part of being a great nurse or being a great historian or being a great researcher, as Dr. Gray talked about, it's about recognizing that in this work, it's interaction with humanity, it's touching humanity, it's advocating for humanity, it's caring for humanity. And so it's not numbers, it's people. And so if you don't see those around you as individuals or as people, this is going to be very challenging and you can do harm. But also if you don't see yourself as human and as an individual, when you fail, you'll hide it. And as Dr. Lashige was sharing, if you can't be vulnerable in those moments, you really miss the lesson and the opportunities for growth. This is serious work that we all do. And so when we fail, there are consequences, but we're growing as we're pursuing. And so never stop learning, invest in those mentorships, but also create space in the journey to also be a person. Because we don't want to see you get burnt out. And burnout does happen. I think we probably could all speak on moments where we've needed to take a break or step away. And so building this practice now before you enter the field will help later.
Thank you. And I appreciate that you've touched on those soft skills in as well as those clinical concepts and the textbook information that we need to know that, you know, it makes a big difference when you're willing to be vulnerable and willing to be human and show that side to your patients as well. Thank you very much. Dr. Young.
So my advice is to get started. Get started. Every decision that you make along your career path is not the end final all decision. Some you like, some you won't like. Guess what? You can change it and you can do something different. But you gotta get started to even learn all the various areas that are out there. I'm gonna even share, so I work at a clinic where I have a lot of Spanish speaking patients. I have a Spanish medical interpreter at my side every day. So for any of y'all who are bilingual, this is a great service to provide for patients. Of the interpreters that I have worked with, so my first interpreter went on to get his bachelor's degree, and I believe he got a bachelor's degree in some type of healthcare field. Then I got a second interpreter. My second interpreter has gone on to nursing school and just graduated last semester. So then I got a third interpreter. The third interpreter started out as a patient service rep at the clinic. Then she became a coder. Then she became my medical interpreter. And now she has gone to medical school and nursing school and starting an advanced program. So I have difficulty keeping interpreters working with me, but I love them sharing with me and being a motivating factor and letting them know. I just say, just get started. Because I tell them, I was like, look, I'm going to retire from this job. So do you want to be here when I retire? How about let's figure out what the plan is? And then they get started and they find things that they love and you can transition. But please get started and find something you enjoy.
Thank you very much. I agree. We need to encourage everyone to just start somewhere. You'll never succeed if you don't start. So that's wonderful. And unless there are any other comments from the panel, we're going to lead into question number 3.
All right. Number 4, right? Okay. So thinking about the past 3 years and how everything has changed with COVID-19, what are some challenges that you all faced in healthcare that may not be universally known? Dr. Gray?
Okay, so the first thing that came to mind when I read this question was just remembering 2020. And as a physician, you're even just working in healthcare, you're sort of in this club. And it meant that you were privy to information that maybe wasn't quite in the news yet. And so I just remember in early March, sort of watching and knowing the tsunami was coming. And yet it was hard to figure out how to impart that information to loved ones and friends, because everybody was going about their life as though like, oh, it's okay, it's no big deal. And so it was really scary. I mean, I just think, in the beginning, healthcare workers were lauded as heroes, and on some levels, I think that is true. But I think what was lost in saying that was that we were humans who were terrified, and we were terrified for our own health, our family members' health, our financial status. If you were in private practice like myself, you were really wondering, am I going to have patients to see that is my income? Many outpatient practices had to close because elective procedures were not allowed for several months. That meant those offices had no money coming in. And so it was a very scary time. And I think that we would oftentimes not show that because we don't want our patients to know when we're scared. But we were humans too, and we were dealing with the unknown also. I think for myself, I have really looked back on that time and tried to focus on what were some of the positives that came out of it for me. My husband and I worked on our will finally. But just the closeness I was able to have with my kids who were at home during that time. And I was also just very grateful for how our legislative bodies and our government was able to quickly make changes to laws that allowed physicians to practice. Most significantly were the changes in telehealth, which allowed us to continue to take care of our patients and community in a way that was safe, but also very helpful. And that required the government to really make a lot of those changes for us to do the things that we do to help our community.
Thank you. Dr. Lashige?
Yeah, thinking about what Dr. Gray said, I feel like 2020 never went away. It just seems like each year after just seems to layer on top of it. And so I thought about what still lingers today from 2020 that may not be universally known or understood. And the two concepts that came to mind are higher demands and fewer resources. COVID exposed lots of inequalities, inefficiencies, disparities, waste, and overall shortcomings in healthcare operations. And the healthcare world lost a great deal of people. People are no longer here, whether they were released to cut costs or address inefficiencies, or whether they voluntarily left because of burnout, alluding to, what Dr. Tucker talked about. At the same time, patients, rightfully so, have demanded more. They've demanded higher quality and better experiences. And all of the changes, whether it's for operations or for quality, I would say are grounded in data, but we haven't been able to recover and deliver quality care experiences with fewer people. So the effects of the pandemic are still present today without adequate and sustainable solutions, and that worries me.
And Dr. Maynard?
Yeah, I feel like had I intentionally gone into the exact career I went into, I was probably one of the most protected areas of the hospital, honestly. Being in the NICU, there was a very, very difficult time where and I argued against this, but there was a very difficult time when we were not allowing parents in the NICU, which was just agonizing. Unfortunately, that did not last very long. And testing improved, and we were able to just restrict to just the parents, and everybody wears a mask all the time. But that was the worst bit of it, I would say. I do feel like just a general societal change that's been happening for a while during my career has been just like a slowly diminishing trust in the medical personnel, medical abilities, and yet at the same time, they're asking us to try to save patients' lives who may or may not be, who have a very low chance of survival outside the womb. And I think that was a societal change that was happening before we got to COVID. And I think that the mistrust of the medical system has gotten much, much worse since COVID. I think, some of that is just the whole existence of social media and the way somehow COVID got politicized. I think that made things very, very much harder. At the same time, of course, everyone is stressed. There are people leaving. Right now, I feel like all of our nursing staff, it's sort of very, very young nurses, people who are literally in their very early 20s, who are actually already training yet newer nurses. And that has been rather on the stressful side. At the same time, I feel like there are some things we should keep from the pandemic, like more telemedicine. We do prenatal consults where the parents would have to make an extra trip to the hospital to meet with a neonatologist for us to kind of explain what they should expect when their baby is born. And now we can do that via telehealth, which spares a pregnant woman from this, sometimes a 1 hour drive into the hospital to get information she could get via Zoom or Doximity. I think that's something that's an advantage. But yeah, I think just the decreasing, the primary thing that I have noticed, which makes it much harder for us to do our jobs. The whole team is wanting your baby to do as well as your baby can possibly do. And it just sometimes can be really difficult to feel that the person that you're trying to help is really truly does not trust you. And I don't know how to get around that in some certain cases.
Thank you for your frankness. I think it's really important that our students go into their future professions with their eyes open and that they're prepared for these challenges. Thank you. Dr. Tucker?
Yes. Adding to what my colleagues have just shared. So palliative care is not end of life care. Palliative care is something that focuses, it's a form of care that focuses on symptom management and quality of life, and goals of care conversations are really at the center of what we do and provide in addition to our symptom management on our inpatient unit. And though I take care of adults, so 18 and up, we similarly to Dr. Mainer's environment, there was a point where we were allowing one visitor. And so if someone's parent was passing away and they had 6 other siblings, we essentially as nurses, and it was just a really challenging time. You're kind of playing gatekeeper, but also decision maker, and who is allowed to be present at the end of life. And so I think ethically and also just existentially, it was asking the questions of what does a good death look like? Who gets to be here? Who gets to be involved in this space? And on one hand, we were fortunate to be able to use technology. And so iPhones, iPads certainly became critical in this care environment and in this space. But there was a moment in time where it was very, very challenging also as nurses while we were providing this care to also manage the weight of grief and anticipatory grief that we understood that our families and the community was facing. And so I have always said that, families are such an integral part of our care team, and we could not do what we do without them. They're advocates, and especially at the end of life, there are many patients that cannot advocate for themselves. And so families are part of that care environment. And so the absence of their presence in that physical space required us to put on an additional hat that we did with honor, right? Like we saw this as a privilege, but we also did it knowing that we may fall short. And I think that is where extending grace and forgiveness and remembering you're human also became critical. The med room might have become a place where tears were shed. Also using music and music therapy, just adding additional resources. The chaplain, I know that my colleagues have also been talking about other members of the care team, and I don't know that we've mentioned like the chaplains have always been important, but very important, very visible. Music therapists, our volunteers, though even that paused for a little while, but adding additional layers so that we were ensuring that patients had high touch and quality time with others. So that was a challenge. And then in terms of, that's my nursing lens, but as a historian, I think as we've been talking about, like the trustworthiness of institutions and organizations, our community is also healing. And I think part of the healing is also the reckoning with past harms and past traumas that some institutions have been responsible for, or even governing bodies have been responsible for, that have not been not only acknowledged, but brought forth in a substantive way where there's been lasting change. And so I think within the pandemic, greater social questions of who matters, who gets to count as an individual, that also came up. And I think that's something that we will continue to work through. But this is when I also see the humanities playing an important part of answering some questions that science can't answer alone. So that's where I see nursing as an art and a science. And so while you're taking these courses, add room for the humanities too, because that will shape your lens and how you see questions and seek answers.
Thank you.
May I just interject really quickly? I'm so sorry. What I also wasn't saying, that there has been a vast amount of historical racism in the medical field. And I think, as you're saying, Dr. Tucker, that has never had a full reckoning, and that's certainly part of the problem. And then there are different additional factors of people that have just, on the other side of things, have chosen to just believe what they want to believe and not, being very vague here, have just chosen to believe Facebook instead of believing a trained medical professional. So
I appreciate you bringing all of that up. I feel like this was an important part of what we've experienced. So Dr. Maynard, yeah, thanks.
I mean, it sounds like a very exciting time to be entering the field too for our students, all of these opportunities. Dr. Young?
Okay, so during COVID, I have had a few different hats and a few different lenses to take part in. So let's start with the fact that when COVID started, I was definitely a newlywed, and it is make or break when you spend every day with the person you love. So, and it was make for us. It helped our relationship grow so closely. One of the things that became a significant factor for us is, so at the time, my husband was also in the healthcare field as a community counselor. So going out to various adult living facilities, I have a chronic illness that makes me immunocompromised, and medications that affect my ability to fight infection. Scary time for knowing what was going to happen with COVID. We had a whole re-entry protocol for our home. He was literally, getting undressed in the garage when he came home and coming in straight to the shower, and just all of those additional factors we had to take into account for us as newlyweds, as getting to know each other and learning to live together with love and grace and forgiveness and all of those things. From a work standpoint, with my hat as an ethicist for the healthcare system, we had to talk about resources. This was a time when hospitals and healthcare systems were running out of resources, running out of ventilators. We had to come up with a protocol for our hospital. And to sit on that committee and sit at that table to try to make decisions that are fair and ethical and equitable care for everyone really takes a lot of care and time, but also it's heavy. I am fortunate, we are fortunate that we never reached a point where we had to invoke that protocol. But just sitting down to have that conversation here in the US, I would have never thought going into medicine that we would have been in that space. The other lens for me is working with a free clinic. We partner with churches in the community. So our clinics start out in your place of trust. And we're a mobile clinic and we set up every day. The church is closed. How do we care for our patients? Within 3 days, when the church is closed, we went from a face-to-face clinic to converting all our clinics to virtual and learning that as we went day by day. How do we make this work? How do we, really get to you get creative with ways to do your exam. You learn how to pull up the video resources. And for our patient population, what we realize is virtual visits is here to stay. When you're working with the uninsured and they're walking and taking buses and going through several different barriers to receive care, and now we have a way of meeting them where they are. They don't have to miss work. They can say, call me on my lunch break. It works out very well. So that's something we learned, something that's here to stay. And I am grateful that it has increased access of care for all to make health more equitable for everyone.
Yes, thank you. So a lot of flexibility and adaptability getting through this time, and it's good that we have some positives that have come out from COVID. That's good. Okay, we have one last question for the panelists. What is one piece of advice you would give to our community college students? Dr. Gray?
Okay, so I think everyone here watching and all the panelists, we all want to be successful, and there isn't really a clear roadmap of what that looks like. And everyone's path is certainly going to look different, but I think two things that I think make a difference, which is recognizing that it's going to take risk, and that risk is not always going to look the same. Sometimes that risk is asking for help. Sometimes that risk is recognizing the people in your circle who maybe are not supportive of you moving in a different direction. And that can be very difficult, because not only are you maybe leaving some people behind, or not interacting with them as much as you used to, but you're also moving into a group or a circle or community of people who you don't know, who maybe are different than you, who have different experiences, who travel to Europe every summer and drive sports cars, whose parents are doctors, who don't worry about how tuition gets paid. And as much as you may want that life for yourself and for your children, it's really scary to now be sitting with them. But you belong there. You absolutely belong there just as much as they do. And your experiences and what you bring to the table is needed just as much as theirs. And maybe yours is needed even more. And so you may have to remind yourself that you belong there, even when your skin is crawling and you feel uncomfortable and you want to run out the room. You need to stay there. You need to stay there because you belong and you are needed. And because even the people who you maybe had to walk away from and leave behind, they need you to be there. And then I think the second part is facing your fears, which is a little bit differently, but it's really uncomfortable to to walk into a doctor's office and you don't know anything. You don't know anything about medicine. You don't know anything about the human body. You don't understand how needles work, and you don't even understand how the fax machine works. It's really scary when you show up in the hospital and there are people with white coats on who seem really smart, and nurses are moving around, and there are sick people there. It's really scary. And I just want you to know it was scary for all of us initially. But you keep showing up every day. You ask questions, you study, you read, you learn, you practice, you make mistakes, you learn from them, and you show up again the next day. And then you realize you like being there. It's not so uncomfortable. You actually understand how to use the fax machine. I use that because in medical school, that was always like the hardest thing to figure out the first day was how to use the fax machine. The students watching, they're like, what is a fax machine? But it really does start that basic, and that's simple in terms of the things that you have to learn in order for you to get to a place where you feel like you belong there and you feel as though you are bringing something to the table and you're useful and helpful. But it's uncomfortable in the beginning. It really is. But you will you will develop the skills that you need and a comfort level. But you have to ask questions. You have to ask questions. And you have to build on the knowledge that you have. You can't just stay at that same level, and it will get better. Oh, we can't hear you.
Thank you, Dr. Gray. I hope our students were taking a lot of that to heart because that was some really good advice. Dr. Alashige?
My advice is simple, and it's actually related to earlier advice given by Dr. Gray. It's that there are many paths that can be taken within the healthcare field beyond the traditional ones. Allow yourself to be open-minded, allow yourself to change your mind, but most importantly, make sure you can articulate how your choices align with your passion and what you feel your purpose is. Because your passion for your day-to-day work will be what helps you endure through difficult experiences.
Okay, thank you. Dr. Maynor?
Yeah, I have to admit that I wasn't a great studier until late college to medical school, but I think figuring out the way in which you learn best is always helpful for anybody in any kind of training program. For me, it was reading a hard copy of something, underlining things, writing things down myself that helped me remember things a bit better. I think for some people it's very auditory visual. I have a little ADD, so I check out halfway through every sentence if I'm trying to listen to something and I'm not writing it down. I found it really helpful to write things down, but that could be very different for others. You may want to learn by video, and there's so many different ways of receiving lectures and receiving information now that education, I'm sure, has changed a lot just from time passing and new technologies. But I would say try to figure out which is your best learning style and use that to your advantage.
Thank you. A lot of these things we focus on in our programs at TCC as well. So it's very good advice. Dr. Tucker?
I'm so glad I'm muted because every time someone speaks, I'm like, yes, that's right. So if you see me nodding, it's because I'm also making mental notes, because everything that everyone is sharing can be applied even once you're in your profession or changing your professional goals or aspirations. My advice I received from a mentor recently, Dr. Fatima Williams, who's not a nurse, but has her PhD in anthropology. And as she was giving me some coaching advice, she just said, take a moment to remember what you have in your hand. And so you all as students currently, some of you are here because you're making a career change in your career path. And so what you might be bringing to the healthcare field is experience in another area where your leadership, your ability to delegate, your ability to see a problem and execute and find solutions or to collaborate may be a strength, whether you're entering nursing school, PA school, med school, whether you're going to become a respiratory therapist, a chaplain. so just don't forget that. It could also be that some of the experiences or life experiences that you all have had, and I think this goes back to something that Dr. Gray shared earlier, that she's like, I didn't see barriers. And so maybe some of the barriers, maybe some of the things that socially have been seen as shortcomings are actually your strength that you get to use. And you've developed some really critical skills and knowledge that will make you the perfect advocate for your patients, for these families, or even for your colleagues. So I'm just excited because we can't see you all, but I just imagine you all, and I'm like, man, we are seeing future healthcare professionals that are going to really improve our system and move us forward in some significant ways. So don't forget what you have in your hands.
Thank you. And recognizing each one of those students as an individual as well and what they bring to the table. It's beyond their education or formal training. That's really good. Dr. Young?
Okay, so my bit of advice is only accept no from people who have the authority to tell you no. My story that goes with this is undergrad, I did biomedical engineering, wanted to go to medical school. Engineering is not an easy major, so maybe my GPA wasn't a 4.0. But the chairman of the department, when people were sharing what they wanted to do after graduation, when I said go to medical school, his response to me was, miracles happen, but the Red Sea was only parted once. I thought, how dare you? You know, you are not at any medical school to accept me or reject my application. So you might say no, but you don't have the authority to tell me no. So apply, reach out, go for your dreams. There are people along the way who are going to discourage you, make negative comments, make you feel like you are not worthy, like you are not good enough, like you are not smart enough. And I promise you it's going to happen. When it happens, you do not accept no.
Thank you, Dr. Young. So there's some quotable moments in there.
Is there a mic for us to drop? Because I'm just like, woo, Dr. Young. Yes.
Very, very inspiring. Thank you all so much for answering these questions. Now we do have some from students, so I'm going to hand it off to Amanda Leo.
All right, thank you, Brittany. And thank you again. I don't know if this is being recorded in any form or fashion, but I've been taking so many notes to share with our students in my program and within the health professions building as a whole. And I think there's some great advice that all of our student population can benefit from, not just those interested in healthcare, but just pursuing that end goal that they have and recognizing that, you know, some of these barriers are not just applicable to healthcare professionals, but to all careers that they're interested in. So thank you very much. And I'm now going to start with the questions from the chat from our audience. And the first one, which I'm very interested in hearing myself, is what influenced you or inspired you to work in healthcare? And I know we've been going around by names, but yes, Dr. Lashige, if you'd like to start, just feel free to jump on in. Thank you.
Sure, I'll take this one. And I think my influence and my inspiration was kind of simple and then kind of complicated. You know, there's this quote that people always say, you can't be what you can't see. And I argue that and I defy that because I was inspired to be what I didn't have and what I didn't see. So I grew up in Newark, New Jersey on Medicaid to a whole family that has never gone beyond high school. And I had a pediatrician that was an older white male that I felt like knew medicine very well, I guess. I trusted that, but he didn't know me and he didn't know my family. And I also witnessed him disrespect me and my family. And later on, I followed some news articles and found out that he was even frauding Medicaid. And so I went on to become a Black female pediatrician for me, for my younger self. And now that, you know, fast forward a couple decades, I am a clinical executive over Medicaid business. It just kind of brings my story full circle.
Thank you so much for sharing that. Anyone else, any of our other panelists like to share what inspired you or influenced you in choosing a healthcare profession? No? Okay.
Yeah, I think I said this in the very beginning that it was a mental health issue in my family. But then, of course, I think everybody's been saying, be prepared to change your plan. And that's the right thing, because the right fit for me did not eventually end up being psychiatry. But yeah, I think it just shows that you can start out thinking you want to do one thing in medicine. And because medicine is so all encompassing in so many different fields within medicine, you've got many choices, even beyond what you start with.
Thank you. The next question that we have is, what educational advice do you have for a student trying to become a physician's assistant?
I guess I'll chime in here. So my daughter is currently pre-med, and so she has a group of friends who are all sort of wrestling with these questions. There really is no difference in trying to get into PA school and medical school. It's exactly the same, which means it is just as competitive, quite honestly. And so all the same prerequisites, you need to be aiming for is the highest GPA that you can get possibly. You still have to take the MCAT. So it's really not that different. I think one of the differences that students sort of start to recognize within themselves that helps them make the decision is that they sort of recognize that they don't like the idea of being the final decision maker. They would prefer to have a go-to person, the physician to go to as someone to kind of support their clinical decision or plan for a patient. It's sort of, they don't want the buck to stop exactly with them. They like the idea that there's someone else where whom the buck would stop with. PA school is shorter, and so certainly for some people, financially, et cetera, it may make more sense to have a shorter route to get to PA school rather than medical school. And then the other piece that I hear probably most commonly from students is they like the idea that they can move around from specialty, which is not possible as easily. And if you go the medical school route, it is much more difficult. It does happen, pivoting is still a possibility, but it's much more difficult to switch specialties. So to move from pediatrics to gynecology to ER, that is much more feasible if you go the PA route, as opposed to the medical school route. But in terms of academics, you got to knock it out of the ballpark, whether you're applying for medical school or PA school.
Any other comments on that question? Okay, now this one might be more for Dr. Tucker, but if anybody else wants to weigh in, we've got someone asking, what are the differences between nursing schools and actual colleges?
That's a great question. And I'll start with saying I'll share some thoughts there, but they're certainly not finite. And so this is when I would say, make sure you talk with your career counselors or those in the professional schools that can provide additional insight. So when I think about my path, so I transferred into the School of Nursing at the University of Virginia for their BSN program. One of the benefits for being at the university meant that I also had an opportunity to take my electives in addition to my cognates outside. Some of them I took in the School of Nursing, but then it meant that if I wanted to take a class in the School of Architecture, if I wanted to take a class about like health and design or courses outside of the School of Nursing, I had access to that. It also meant that my colleagues and the individuals I was learning with, everyone was not beholding to be in the School of Nursing. So when I took my nutritional course, there were students in the School of Medicine, those who were interested in biology. And so I would say The difference is that if you are at, let's say, a university or a college, and there's a school of nursing connected to that university or college, it also gives you the affinity to benefit from some of the extracurricular activities, but also the additional schools and curriculum that may be outside of your program. That being said, if you kind of are on the path of like, I have limited time to pursue this, and so there may be less flexibility on like when your clinicals are in that college sort of university setting, or even when your courses are. And so you may find in a different school of nursing that it may align with your work and life schedule if you're at a school that has evening classes or opportunities to do clinicals on the weekend. So I do think as you're looking at schools of nursing, whether it's a school that is independent or one that's affiliated with a university or college, you kind of look at the process holistically, what will be best for you and the community attached to you. But if it's for you, it's thinking about what is it that I want to get from this time here in this program? What do I need to be supported and successful? It may also look like, is there space to move and relocate? If not, I may need to work with what's here. But knowing that what you maybe don't get in one environment, you can build and get in other spaces, whether that's internships or externships. I know we didn't talk about that, but those are also things that you can potentially build into your learning experience as well.
Thank you. A lot for our students to consider. And we have one final question, and some of you, based on your bios that you told us about yourselves at the beginning of our session today, have moved around quite a bit. So whoever would like to answer, do you have any advice for a student who's considered making a big move from their hometown to somewhere new?
So I'm going to start with that because I like to travel. So, and I like new experiences. So for all of my learning, I've gone from cities like, I grew up in Fredericksburg, Virginia, but I've been in New Orleans, been in Atlanta, been in Charlottesville, and every step of the way, you just enrich your life by meeting new people, having new experiences, seeing new things that are out there. I didn't love Thai food till I moved to Atlanta, so it's just certain things that you're going to get on the journey by increasing your opportunities that are going to grow with you through life.
I'll add to Dr. Young's comments, and I laugh because I've moved quite a bit. And actually, I am 2 months into moving to Atlanta, Georgia. So I'm from New Jersey. I did undergrad in Connecticut. I went back to New Jersey for medical school. I went to Louisville, Kentucky for residency, stayed there for fellowship, went to Dallas to do NICU, went to Houston to do NICU, got into managed care in Houston, went back to Kentucky, Minnesota, don't ask me why, and now Georgia. Like Dr. Young said, you learn so much in all the different spaces. And I'm thinking about a comment from Dr. Gray where I belonged in all of those places. And so I had to take on those as if they were for me, but I also was vulnerable in each and every one to say, I know what I'm bringing here to share experiences with you all who have not lived in those places that I've lived, but I'm going to be open to say, teach me about your space, and I want to experience it in its fullest. And that's the only way I can then take that experience to the next place. I hope to not offend any cat lovers, but I always say I learned by moving so much, there's more than one way to skin a cat. And so I take that as flexibility, adaptability, and I incorporate it into my work. I will say, being very transparent and looking from the outside in, an employer may see that as a risk, right? You keep moving. Why would I hire you? Why would I pay and invest in orienting you when you might move in 2 years? And that is real. And you got to tell them that's real. But in that moment, be authentic in why you are there. And that's all you've got.
Thank you.
Thank you. I really appreciate the responses to that question, specifically knowing what a transient population we have here at TCC, what a high military population, and knowing that for some of our programs, we see our students during that 2-year time frame where they're stationed here or their family is stationed here, and then they're going somewhere else right after. And sometimes graduates have the opportunity to be in control of where they're going and choose a place that they feel comfortable or a best fit, and sometimes they don't. So I appreciate the input on resiliency and exploration and opportunities that can be found.
And
Amanda, can I add
TCC's
one more
motto.
thing? It's just a piece of advice for the students that, like you said, if they truly have transient lives, this may help them. You know, I believe that nationally, the healthcare priorities are the same. People are going to say, hey, what are your priorities for Georgia? Well, guess what? They're the same priorities for Minnesota, because nationally we have the same issues. But I really believe that healthcare is local in the way that it's delivered. And so when people do move, they can say, hey, I understand this priority as a whole. Let me tell you how they did it in Texas, because you may not know. And so you can lend ideas and experience and ways to do things differently that will improve the quality of the care where you are at the moment. And so have that in mind and use it as a strength rather than a barrier.
Thank you. I agree very much. And I think that also goes back to the conversation earlier, talking about students who may be at different points in their life and have different life experiences, or some students have more experience and some have less, but to use that as a strength rather than a barrier with where your point of entry is. So thank you.
I have one more comment as well.
Yes.
I always tell students that I work with, your journey is your journey and no one else. You are placed in places on your journey that are specific for you and your needs. And you sell yourself based on the things that make you special, the things that make you stand out, the things that make you unique, because no one's journey is like yours. And so sell it and just go through your journey, loving every minute of it, knowing that it's making you who you are.
Thank you. Brittany, I believe, was there something else you were going to add?
I was going to say that our college's motto is "From here, go anywhere." So we do pride ourselves in preparing our students to succeed no matter where they go after leaving the college.
Yeah, I agree. And I know I noted down earlier, Dr. Gray said start somewhere. And I believe Dr. Young had indicated that as well. So I said, well, if you're going to start somewhere, start here at TCC, and then you can go anywhere. Just a little shameless plug. I think with the time where we're at now, without seeing any additional questions in the chat at this point, I'd like to kind of bring this panel to a close. And first and foremost, I think I speak on behalf of everyone here, but it was an incredible honor to be a part of this with you and celebrate Women's History Month and have you share your stories and your experiences and your advice with all of our students here at TCC. It's been very inspiring. And again, I think there's a lot to learn and grow. And I thank you all for being on this call, for giving of your time and your expertise, and just sharing, taking the time, again, as you said, to be human and make these personal connections and offer up your thoughts with us are very valuable. So thank you so much. Are there any other questions or anything that anyone would like to share? Because otherwise I was just going to remind everybody of some of these opportunities here at TCC to pursue their healthcare ambitions. Okay, well, as a representative from the Division of Health Professions, our health professions pathway here within TCC, I'm going to reiterate that what Brittany Horn had shared earlier. There are 13 different pathways here and programs within the Division of Health Professions. And yes, some do have connections that can lead you further on to a doctoral degree. We have nursing pathway, EMS. We have all levels of that healthcare continuum. I myself am an occupational therapist. I know physical therapy was mentioned earlier as well. And we work in a big field where there's so many options. So I really appreciate that that was shared earlier today, to be open and flexible with where you want to go. And if one path doesn't really truly meet your needs or satisfy you, or that pathway maybe tells you no, don't let that be a barrier. Let that be an opportunity to find where you fit and where you will be successful. On our webpage, we have a page dedicated to the Division of Health Professions where you can explore all of our opportunities here at TCC. And there's also information on the monthly information sessions that each of the healthcare professions offer. It's the third Thursday of every month. If you go to the division's webpage and you click on those different professions, it'll tell you specifically what time it is. But it gives you an opportunity to hear in depth about all of our different all of our different programs, and again, be open, explore different pathways and hear what they may have to say, and ask how they're connected, and ask these valuable questions that we've talked about today about potential barriers, about opportunities, about how COVID has impacted it. Ask those hard questions so that you're fully prepared to make the best decision for you. And hopefully it'll be here. Thank you all very much for joining us. And with that, I believe we're going to call this to a close.